Hi, YouTube fam. I am Angeline, the nursing assistant. Today we'll be discussing how to prepare yourself for an interview. Let's get into some classic questions that an interviewer usually asks. Tell me about yourself. Why do you want to become a CNA? What are your strengths? What are your weaknesses? When you come across a difficult patient, how would you handle that? How would you handle a patient that's refusing to give care? As a CNA, what sets you apart from others? Where do you see yourself in 5 years? Do you have any question about your position or our companies? These are just some classic interview questions that you need to be prepared to answer. Tell me about yourself. This kicks off many interviews, so you need to be prepared with a strong response in advance. The interviewer wants to get to know you, but they also want to know your skill, experience, and strength that will help their company. Paint a positive picture of yourself by detailing the accomplishment and showing your passion for the job and focusing on how you helped others in the past. Share something unique about yourself so the interviewer can remember you. End on an upbeat note that connects your response to this job. Why do you want to be a CNA? This answer may be unique to every individual. So whatever it is that made you want it to be a CNA, then this is the time to discuss it. For example, you may have to take care of a family member, and in the midst of you taking care of them, you realize that you had a satisfaction of taking care of somebody, nursing them back to health. This gave you gratification. So whatever it is that made you become a CNA, then you need to tell the interviewer, and also let the interviewer know that you have the skill and know how to be a good nursing assistant. What are your strengths? Although it is important that you highlight your strength throughout the interview, what this question is really asking is, how are your strengths making you an exceptional CNA? Own your strength. Provide evidence of your value. Focus on your organization skill, your reliability, attention to detail, your communication skills, and your strong work ethic. What are your weaknesses? This is a tricky question, so you need to have thought of this or prepared for this in advance. Try not to respond with a weakness that is a key part of your job. For example, you can say as a nurse assistant, my weakness is I tend to go in and help people too fast, not giving them a chance to see could they do it themselves, because I'm so used to helping and wanting to be a help, I usually go right in before I give others a chance to see can they do it on their own. So be prepared to know your weakness and do not give them a weakness that is directly a key opponent to your job. As a CNA, what sets you apart from other candidates? At this time, you can tell the interviewer why you feel that you are right for this job. If you have specialized in certain education, took certain courses, maybe you even volunteer, got certain certificate that may set you apart from your other candidate, at this time, all of this needs to be shared. How would you handle it if a patient refuses care? The interviewer wants to know how you respond to conflict. So ensure the interviewer that you not only can respond to conflict, but you can turn it into a positive. Make sure, emphasize that you ensure that the patient understands what he or she is refusing and tell them the consequences. Let them know that you're there to help them. And be prepared if the interviewer asks you, well, once you do all of this here and none of this helps, the interviewer may have a follow-up question as to say, now, what would you do? So my advice is, if the interviewer come back with a follow-up question saying that you have did everything that you needed to do to get the patient to accept the care and the patient still refuse, then you will report this to your nurse, or you will leave the patient, wait a little while, and come back and ask again. And if that doesn't work, then you will report to your nurse, because a patient do have a right to refuse care. Where you see yourself in the next 5 years. What the interviewer really want to know, will you be here with this company? Because it is very expensive for a company to train an employee and then they leave and they have to train another one. So the interviewer really want to know, will you be here for the long haul? So if your desire is to stay in the medical field, then say that. Say, I want to stay in the medical field. I may want to advance, or I may want to go back to school to become a nurse, but the medical field is where I want to be. So the interviewer likes that answer because it rests assured that you will be here for the long haul. Do you have any questions about the position or the company? This is pretty much a guaranteed question. So have your question ready. Because if you don't ask any question, it may seem like you're uninterested in the role. The interviewer have sat down 15 to 30 minutes asking you questions to see were you right for the position. Now it's your turn to ask questions to see, is this company right for you? Do not ask about vacation, benefit, salary. Save that until you get the offer. Instead, ask, what do you like about working for this company? What are your dislikes? Can you tell me what a typical day look like? What are your training protocol? Is there a lot of turnover? And if so, do you know why? These are the type of questions you need to ask. As a CNA, you will make a real difference day to day. Just review your interview basic and you'll do great. So I would say good luck on your journey to your career and to your new job. Subscribe, like, and hit that notification bell because you don't want to miss not one of my videos. Come on, let's get it started.